If you're taking certain types of RLS medication, you have a 20 to 73% chance of developing augmentation. Augmentation is when this medication makes your symptoms worse instead of better. It's not tolerance where it stops working, it's actual worsening. If any of these following things are happening or starting to happen, then it's a clear sign of augmentation. So if your symptoms start earlier in the day or you need higher doses of your medication to get the same effect, if symptoms are getting more severe or symptoms are spreading to more areas of your legs or body, the medication that used to help is now a problem. I'm Mark Chapman. This is happening to me right now after 6 years on medication. And today I'm showing you how to recognize augmentation, what the research says, and what you can do about it. Now, this is an effect seen when certain dopamine medications like pramipexole, ropinirole, retigotine, or levodopa. There are others, there's a full list in the description below. If you're on any of these, here are the 5 warning signs of augmentation. Warning sign number 1, earlier symptom onset. So your RLS used to start at 9 p.m., now it's 6 p.m., or it's 3 p.m., or even it's in the morning. This is the most common sign. Warning sign number 2, you have increased severity. Your symptoms are more intense than before you started medication, even though you're on higher doses. Warning sign number 3, shorter symptom-free time. So the window where you don't have symptoms is shrinking, or maybe it's gone altogether. Number 4, symptom spread. RLS is spreading up your legs, perhaps into your arms, your trunk, or your face. This one is a major red flag for augmentation. And number 5, you have a shorter medication duration. So your medication used to last all night and perhaps into the day. Now it wears off after a few hours or a much shorter period. If you have even 1 or 2 of these, talk to your doctor about augmentation. Now, this is quite common. Research shows that depending upon the type of dopamine medication you are using, augmentation can occur in 20% to 73% of people. So it's not rare. If you're on these dopamine medications long term, there's a significant chance this will happen to you. I started 6 years ago on ropinirole at 0.5 milligrams. Over that time, my doctor and I gradually increased the dose to where I was on the maximum of 4 milligrams. And look, to be honest, sometimes I took more than that because the pain was still unbearable. My doctor didn't know about augmentation. I was actually the one who gave her the information. And I'll explain why doctors don't know in a minute or two in this video. But at the time, we thought this was normal dose adjustment. Now I'm on the maximum dose with symptoms worse than ever. I've even got them in my face, which has probably been the most shocking part of this. It's textbook augmentation. Why does this happen? Well, dopamine medications work by stimulating dopamine receptors in your brain and spinal cord. Initially, this reduces RLS symptoms, which is why they work so well at first. But over time, your body adapts. It down-regulates those dopamine receptors. So you need more and more medication to get the same effect. Meanwhile, the medication itself starts triggering the symptoms it was supposed to prevent. Dr. John Winkelman, a sleep medicine specialist, describes it as putting out a fire with gasoline. The more you use, the bigger the fire gets. Now, this effect wasn't widely known until 2025. In January of that year, the American Academy of Sleep Medicine released new clinical practice guidelines for RLS treatment. The dopamine medications no longer recommended as first-line treatment. They've been moved to second line because of this augmentation risk. The new first-line recommendation are drugs called alpha-2 delta ligands, things like gabapentin and pregabalin. These medications don't cause augmentation. But because it's so new, many doctors simply aren't up to date with these new recommendations, and you may need to be the one to advise them like I had to. Now, here's a critical warning. Do not stop dopamine medication suddenly. Abrupt withdrawal can cause severe worsening of symptoms, even beyond where they are, and potentially serious side effects. Any changes to your medication must be done under medical supervision. So what do you do if you have augmentation? If you're recognizing warning signs of augmentation, talk to your doctor about switching to gabapentin or pregabalin. This requires careful tapering off the dopamine medication while starting the new one. It must be done under medical supervision. I'm currently working with my doctor to transition from ropinirole to gabapentin, and we're doing a slow taper. It's not easy. There's a period where symptoms can worsen during the transition, but research shows that most people who successfully get off dopamine medication see improvement in their RLS after the transition period. If you're newly diagnosed, if you haven't started medication yet, ask your doctor about starting with gabapentin or pregabalin instead of these dopamine-based medications. You can show them the 2025 American Association of Sleep Medicine guidelines if needed. I'll put a link to those in the description below, because these medications are now recommended first line, specifically because they don't cause augmentation. Starting on the right medication from the beginning prevents this problem entirely. Okay, if you're dealing with augmentation right now, I know it can feel overwhelming. Your medication was supposed to help and now it's making things worse. But there are options. The transition of dopamine medications can be difficult, but many people successfully make it and see improvement in their RLS. So you're not stuck with this forever. Now, an important disclaimer. I'm not a doctor. This video shares my personal experience with augmentation and summarizes published research and the 2025 American Association of Sleep Medicine clinical guidelines. It is not medical advice. Every person's RLS is different. Every person's medication response is different. So treatment decisions must be made with your healthcare provider who knows your complete medical history. Do not stop or change medications without medical supervision. Abrupt withdrawal from these medications can be dangerous. If this video has helped you, please hit the subscribe. I post twice weekly about managing RLS based on research and real experience, both what works and what doesn't. And if you can hit that like button, please do that. It helps this video get out and help more people.